All right, Kathy, now you want to bring up Jamie and
Rest of the
Becky and got a squeaky door over there.
Yes, no doubt. Okay, so we'll get started. My screen was a little bit different. So we'll talk about the active cases as we always do. So December 13th, we had 378, and now December 20th, 397. So it's been fluctuating over the last couple months. We've been seeing ups and downs, so that's not necessarily unusual. Active cases in Minnesota, December 13th, we had 35,033, and then December 20th, 27,085. So again, that's a pretty big dip, but there may be some catch-up cases that need to happen across the state. But that's the number on the 20th that we have. Active cases in Cass County, again, they fluctuate a little bit, just so they're remaining about the same, 697 and then 696 on the 20th. And then in North Dakota, December 13th, that was 2,236, and then 2,100 in December 20th. Okay, so the active cases by age, again, we've looked at this every week, and we still continue to see the high numbers in the kids and the young adults. That has not changed, just fluctuates a little bit through the age groups there. And then we're seeing the Clay County cases per week. And you can see that overall the cases reported by week since August, which was right around the time we started to see the case numbers climbing after the summer lull. Then the gray bar is a preliminary number of reported cases for last week. So we see that 235, which will surpass the number of reported cases from December 5th. The next slide is our case trends per week, so you can see the broad overview of the COVID waves that we have. So the 4 waves we've been watching. We haven't sustained a downward trend yet. So, nationally they're talking about a couple more weeks, but, hard to predict that. It's a virus, so it's really difficult and challenging to predict when we're going to see a continual downward trend. And then we're seeing, again, the total cumulative cases by age. So total cases is 12,903, and the graph just shows the breakdown of the age groups.
It's the same person's reporting every week. I mean, do we get a report from everybody every week to make this consistent too?
Yes, it's from the Minnesota Department of Health, so that is correct. Yep, it's consistent. Okay, Becky.
Good morning. Before moving on to more data, I just wanted to provide a brief update on what we do know about the new variant, Omicron. There's still much we don't know for certain, and we're seeing science and research kind of play out in real time. So I would just, urge patience, because sometimes when we're seeing this play out in real time, the communication can be a challenge. So I would expect things to change as we learn more. As I'm sure you're all aware, Omicron has been found in almost every state in the U.S., including Minnesota and North Dakota. It's also spreading worldwide. Preliminary data is showing with relative certainty that this variant is very, very contagious, even more so than Delta. If that winds up holding true, we can likely anticipate another surge of cases as Omicron takes over Delta as the dominant strain. There's also some evidence that is showing that this variant is capable of some level of immune evasion. So that means that we will likely see an increase in reinfections and breakthrough infections. Another concern is what this means for therapeutics. So there's been some lab studies that have shown that the most commonly used monoclonal antibody treatments may not be effective against this strain. There are, however, some more promising treatments that are more of a broad spectrum drug that are promising, but those won't be widely available for some time. So some concerning news coming out, about that. At this point, it doesn't look like a new vaccine will be needed, so that's good news. Boosters will play a very important role. The point of boosters is that they increase the level of neutralizing antibodies that we have, and this is considered our first line of defense in our immune system. So if the virus enters your body, these neutralizing antibodies, if we have enough of them, they will essentially attack the virus before we become infected. So the second line of defense in the immune system is what prevents serious illness and hospitalizations and deaths, and that comes from immune cells that are called T cells. And these appear to remain effective, and they're more long-lasting than those neutralizing antibodies. So while we might see more breakthroughs as Omicron can push past, that first line of defense, we are hopeful that the virus will not be able to stand up to these T cells, and so we'll be able to prevent hospitalizations and deaths. So bottom line, get vaccinated and get boosted when you're eligible. Some reports have indicated that Omicron may lead to less severe symptoms, and time will tell, if that winds up holding true. Any questions with that before I go on? I can try to answer.
Yes, Commissioner Kaylee.
Hi, Becky. We're seeing some chatter in news sources about, since Omicron is more highly transmissible, that maybe people should be switching to N95 masks or double masking. Can you talk about that a little bit and what you're hearing?
Yeah, I can try. Not all masks are created equal, so the cloth face coverings are not as effective as, like surgical masks. Obviously the fit-tested N95s are the most effective, but it's not feasible for the general public to walk around wearing those. So that's, I don't know if that really answers your question or not, but wearing a well-fitted mask, especially over your nose, is important. We see lots of people that just wear it around, their mouth, and that's really not protecting you because the virus enters through the nasal cavity. So making sure that you're wearing a mask that's well-fitting is key.
Is it more highly transmissible because the viral load that's being shed is higher, or?
That appears to be part of it, but there's also been some lab studies where they've actually taken human tissue from the respiratory tract and human tissue from lungs, and they've compared side by side the rate that the Delta variant versus the Omicron variant infect these cells, and the Omicron was much, much faster.
Okay.
So this is the updated graph from the CDC, and it shows the level of community transmission, which really has remained unchanged for quite some time. We're still in that high level of transmission throughout all of Minnesota. This is the Clay County deaths per week, so we're still at 111 deaths throughout the whole pandemic. There has not been any newly reported deaths from last week. And this is the hospital admissions for Clay County, and so we really kind of reached a high point of hospitalizations a few weeks ago with 17 admitted in 1 week with COVID. Those numbers have gone down a little bit. So for last week, we've had 8 admissions that we've known about so far, but still at a level that's concerning. This is the hospital capacity information that we have for Fargo. Hospital capacity continues to be a concern, not just for COVID patients, but trauma patients, other, infections. We are starting to see flu activity pick up. So if people have not gotten their flu vaccine, please do so. Flu tends to be worse for the very young and the very old. So at the time of this report, there were a total of 3 staffed adult ICU beds available in Fargo and 1 pediatric ICU bed available. Throughout North Dakota, a total of 13 ICU beds were available, and the only pediatric ICU bed that was available was the one in Fargo. This is just the North Dakota specific hospitalization data due to COVID. So ICU patients, or the number of patients that are admitted to the ICU are up a bit this week at 19. The total number of hospitalized is actually down a little bit. Last week was 165, this week is 141. And there are currently 2 pediatric cases hospitalized. And then the graph on the right just breaks down the age groups throughout the pandemic. This is our broken record slide again, showing the updated SANFORD healthcare system data as of December 14th. Continue to see the same trend week after week after week. COVID patients typically, are not vaccinated or not fully vaccinated. So 48 of the 50 patients that are on ventilators right now are not vaccinated. And this is the breakthrough data from the Minnesota Department of Health. So right now, we're at 3.765% of fully vaccinated people have wound up testing positive for COVID. Breakthrough hospitalizations and deaths still remain relatively low, or very low. So main point here is that vaccination is continuing to offer protection against hospitalizations and deaths.
So Becky, when we have these breakthrough cases, we don't see a comparative percentage from weeks past like we do in some of your other charts. And I'm wondering now, when we're talking about this Omicron variant that's coming out there, I wonder if it would be good for us to kind of flag. I just happened to see in the media now that the first case of Omicron was found in Cass County, I think yesterday is what I think I saw. But it might be interesting to see, once the Omicron takes hold here more often, what that breakthrough percentage might change, or if it changes in regards to that. So it'd be interesting if we could kind of monitor that to see as this new variant comes forward, and if it shows a higher degree or a lesser degree of reinfection, or for those who have had vaccines already. Did you have a comment, Commissioner Gebinger?
Yeah, just, and not to overwhelm us with new data sets, but I think it'd be relevant, not so much for our purposes here, but I'm wondering if the state is going to monitor the efficacy of boosters in dealing with, particularly with a new strain. I mean, we're almost getting to the point where we're comparing people who have been vaccinated, which full vaccination is 2, compared to the unvaccinated. I think we're almost getting to the point where somebody needs to track, or we need to see data that shows how much more effective the immunizations are if you've got a booster. And I got boosted. There was news report yesterday, and I can't remember the multiplier, but it was like 30 times more if you have more resistance after you've been boosted. And this is information I really would like the public to be aware of. We've been preaching get immunized, but we're moving into a period now where I got my shots 10 months ago, and they're not going to be effective if I don't get a booster. And I hope there'll be a data set out there that we or the state health department, somebody can present to get that information through to the public.
Yes, I agree. And I think that data is being tracked. It's just there's a huge lag time with it. At the county level, it's difficult for us to get that information, but the CDC and MDH are tracking that data. And that's part of what they've used to make the recommendation now that everybody over the age of 18 should be boosted, because we are seeing that waning immunity, especially with the neutralizing antibodies that I spoke about. So the vaccines are still effective because of the T-cell response, that second line of defense, but so they're still very effective at preventing hospitalizations and deaths, but we will see an increase of breakthroughs because of those antibody levels that are waning.
Commissioner Kaylee.
So anecdotally, I have been watching that breakthrough cases number increase each week. It was 1 point something, and then after a while it was 2 point something, and now we're 3.765%. So it is going up. I just want to say that we know from all of this data that you've just presented, this fourth wave is being driven by the unvaccinated. It is the unvaccinated, by and large, who are getting sick and who are allowing for more variants like Omicron to develop. And we don't know what the next one is yet. And so everyone needs to do their part if possible. Take the advice of your doctor, but if possible, get vaccinated. Get your children vaccinated so that we can fight this and end this.
Thank you. Okay.
Okay.
Okay, good morning. Moving on, we've been tracking the statewide data, and this data that we're sharing with you today is as of 12/16 for 5 and over. And at this point, almost 67% of the Minnesota residents that are 5 and over are fully vaccinated. So we've made a lot of progress on that. And then the total that have received the booster or third dose now is at 1.5 million. And then it was 1.3 million last week when we presented. So again, significant increase in those doses. Little by little, we are getting people vaccinated. I think the more we keep talking about the need and for vaccine and the more we have an opportunity, the more people are likely to get vaccinated. We continue to have lots of opportunities in our community for vaccine. I'm going to just flip to the next slide there and talk about Clay County Public Health. So our numbers are decreasing. However, we continue every week to have clinics at the Family Service Center. We're offering first doses, second doses, and booster doses. We drop down to the age group that's available for vaccine as quickly as we can. And so this week we have a clinic and we are offering the booster doses for 16 and 17-year-olds that's now been approved as well. So overall, it's been 18,541 doses that Clay County Public Health has administered. And then for last week, it was, flip to the next slide.
Oh, sorry.
123 doses that were administered by Clay County Public Health. We had 11 that were first doses, 2 that were second doses, third doses and boosters were 94. Pediatric doses in that 5 through 11. First doses were 5, and then the second doses were 11. So we continue to have clinics for those families that are bringing their children back for their second dose as well. This week, we're holding just one clinic, and it is Wednesday, tomorrow, from 2:30 to 5 at the Family Service Center. We're using the IT room or whatever it's called, that and the building, and then we're doing Pfizer vaccine. Well, we're doing first, second, and booster doses. I mentioned the boosters for 16, 17-year-olds and continuing to serve the 5 through 11 this week. And then also, as long as we were talking a little bit about flu, I will say we still have lots of flu vaccine available. So if you need a flu vaccine, call our office and we'd be happy to help you with that as well. And then I'm going to just talk a little bit about the testing data next then. So we continue to have opportunities for testing in the community. And this last week of December 12th, we had 420 people that came in for testing, pretty close to an even breakdown between Minnesota and non-Minnesota residents. And then 43 of those tested positive. So our positivity rate for the week was 10.24%. It's a little bit higher than it was the previous week. But a lot of people that are coming in are also finding that they do not have COVID as well. So there's a lot of viruses out there. Best way you can tell is to get tested whether you know you have COVID or not. So, and that's it.
Commissioner Gross.
Are we going to the schools to vaccinate at all, or?
You know, we haven't been, just because the schools have not wanted us to do that, but that's why we're doing our evening clinics and having opportunities for people to come after school and after work to get vaccine in our office, so.
So what were those hours again, this coming week?
So for tomorrow, our clinic is from 2:30 to 5. And again, those, you know, you can register online or you can call our office if you need some help getting that scheduled.
There's another day too, up till 11 or something like that, or?
This is the only one that we're doing this week.
Okay, very good.
Yeah.
And Mr. Chair and Commissioner Gross, like Jamie said, we meet with our superintendents every week, and we have made multiple offers to go out to their schools, but again, they've chosen to not have us come out to the schools. They have, they feel like there's opportunities for all the families, so we've made the offer many times.
Okay, thank you.
Commissioner Kaylee.
You mentioned that there's lots of flu vaccine available too. Is it possible for a family to come in and get their COVID vaccines and flu vaccines at the same time?
Absolutely.
And if they register online, is there a way to indicate that, or is it best to just call or ask when you come in?
Just ask when you come in. We've done quite a few flu shots in conjunction with our COVID vaccines.
And just for the public, I want to say, when Public Health gave me my flu shot, that was the easiest shot I've ever had in my life. I didn't even feel it. They're really good. So, thanks.
And just one more comment, Mr. Chair and Commissioners, you know, Christmas, New Year's, the holidays are upon us. And so the recommendations from CDC and MDH is, you know, obvious, get your vaccination before you gather with multiple households and family and friends. If you aren't aware of what the vaccine status is and you're getting together with a large group, you know, you are at risk, because again, it's the unvaccinated and this, as Becky described, pretty in detail, is, you know, the new strain is really rapidly transmissible. So, you know, you have to gauge your risk about who you're gathering with. And then also, are there people that are immunocompromised in your gatherings, or those with chronic health conditions, or those that aren't eligible for the vaccine? So just a word of caution that, you know, we're in the depths of this, and it's good to gather, and we want to do that. Just be conscientious of the risks of the people you're gathering with.
Okay,
If
I
you're
know.
sick, don't get together with anyone.
Yes, if you're sick, stay home and stay home alone. To the point where you don't need medical assistance.
That's correct.
Last week I had mentioned that we should talk a little bit about this mask deal again. I'm going to suggest we just not even have that conversation today. For one thing, we don't have our full board here, and there are some other developments that are going on that we need to take into consideration in this overall picture, what goes on our campus. So if it's all right with the board, we'll just kind of delay that conversation today and move on. I know that we have a public hearing scheduled at 9 o'clock. But Kathy, I know we're going to have a discussion, an agenda addition that I'm going to have to wait until probably after the public hearing.
Sure.
If you're busy, there might be some information that we might want from you that's we can maybe get later too. So if you don't feel you can stay around, I know our public hearing is scheduled like for 40 minutes, so.
Oh, okay. Well, I
know
can
you're-
certainly come back as
I know you're busy, but we can, you know, we can play it by ear, and we can always notify you if we need something.
perfect.
Okay?
Okay,
Thank you for,
thank you.
thank you.